Good morning, my name is Scott Arthur and I'm the MP for Edinburgh South West, and today is quite a big day for me because I submit my private members bill. So private members bill are a kind of lottery, we can use that word, which MPs enter, and if they win and I came sixth, so that's counted as a win, it gives you the chance to introduce legislation. And I've been lucky enough to, because I'm in the top 7, I've had time set aside for me probably in March next year. So the focus of my private members bill is going to be incentivising pharmaceutical companies to bring forward treatments for rarer cancers. And a big driver for this is my father-in-law. He died due to a brain tumour type called glioblastoma, which affects, I think there's 3,200 diagnoses per year in the UK. And what I didn't know until I came here and I met a fantastic MP called Siobhan McDonough, whose sister also died to the condition, is that the treatment for it hasn't changed for decades, and actually life expectancy diagnosis for most people is 9 months. So it's not a great disease, to be honest, and in terms of how the impact it can have on individuals and their families. So it was heartbreaking to see actually that there's been so little progress in this area. So what we want to do is bring forward an incentive for pharmaceutical companies, hopefully to do more in the coming years. And right now, and there's a bit of flexibility to this because I have until next March. Right now, the thinking is that what we'll do is, where a cancer treatment generally comes forward for approval as a medicine, we'll provide incentives to the company to trial that same cancer treatment on rare cancer types. So they'll have to develop an investigation plan, and that'll be funded by, for when the treatment comes forward, they'll get a slight extension to their patent, which means they can make a little bit of money, a little bit more money for a little bit longer, but then that money can be reinvested in trying to find a treatment. And the term rare cancer can be a little bit misleading. It's defined as, in the UK, as 6 diagnoses per 100,000 people. But when you look at all diagnoses, 24% of cancer diagnoses in the UK are related to rare cancers. So together, they're far from rare. And what I've found since looking at glioblastoma in a little bit more detail is so many people know someone who's died from the condition. So although it's rare, it really does have far reach. And if you're watching this video just now, and you must be because you're listening to me, I'm pretty sure you'll know somebody who's had that condition. And the likelihood is that they will have died from it. That's just the reality because of that short life expectancy at the time of diagnosis. So if this succeeds, it's not going to change things overnight for people facing the condition, but I do hope there's a real chance that it will save lives both from glioblastoma and hopefully other rare cancer types. Let's hope it saves lives in the coming 5 or 10 years. What a great opportunity so early in my parliamentary career. I'm just through the door and I've got an opportunity that so many MPs have waited decades to come top of that ballot. I feel so lucky and also privileged and humbled in all these words, and particularly getting a chance to link it to the death of my father-in-law, because he's still much missed by our family. Okay, take care, bye for now.